I'm Sarah Nargi. We'll be talking about the botulinum toxins today. This particular one is Dysport. There's Dysport, Botox, and I don't even know the other company. I should, but I don't. I never even buy them. There's a couple different companies that make botulinum toxin. They all work the same. The companies will tell you that there's several differences, and one lasts a little bit longer, onset's a little shorter. I frankly can't tell the difference. They're about the same. They last 3 to 4 months. They weaken muscles so that you can't make certain facial expressions that cause wrinkling. So it's harder to frown and generate the lines between your eyebrows, or it's harder to raise your eyebrows really strongly so that it doesn't generate permanent forehead lines. Squinting to prevent crow's feet. There's some wrinkles it doesn't work on, but those are the primary ones that it does. Also some lines around the lips from pursing. It lasts about 3 to 4 months, and at that point it's completely worn off. So today, we'll be doing my lovely patient here. She's got some lines in her forehead, in between her eyebrows, across her forehead, crow's feet, and some lines around the lip that she'd like to have treated. Once the Botox is injected, it takes about 2 to 3 days to start to take effect. You'll notice it's not a real drastic sensation. You'll wake up one morning and kind of look in the mirror and frown, and it doesn't work quite right. And that seems to be about how people notice that it's starting to work. It's at its maximum effect at 10 days to 2 weeks, and then from that point on, it slowly starts to fade away. Worst case scenario, let's say you don't like it, or it's not quite the right pattern, or you know, for some reason it's not your favorite thing. It's completely worn off in 4 months, but by about 2 months it's really softened in its strength. And the injections take just a couple minutes, and hopefully you don't cause a bruise, but the blood vessels are right under the skin surface, so you know, sometimes you can cause bruising that you'll have to use a little cover-up makeup for. It's rarely, I mean, unless somebody's taking a blood thinner, it's very rare that you'll see any major bruising or anything really noticeable, just a teeny little bruise, maybe on the side of the eyes. Okay, ready? Alcohol swab. The injections sting just a little bit, kind of like the lidocaine injections at the dentist's office, but it's not bad. Them. Botox works by acting as a neurotransmitter mimic. It looks like a typical neurotransmitter that would have a nerve tell a muscle to contract and work, but it doesn't work properly. So it sits in the receptor in the muscle, blocks the ability of that muscle to work until it eventually gets metabolized and wears off. There's no real allergic reaction. There's no long-term negative effects as far as muscle damage or nerve damage or anything that you might hear about alluded to in the media. It's just whether or not that's what you want to spend your money on. If you think it looks nice on you, and exactly what pattern and how much of the product